Hello everyone, this is Alim Shah. So today's topic is the in the PV world. Usually, when the PV field, usually there are some confusion terminologies. There are so many glossaries are there. Anyways, we will see in the in detail in the next video. But here I would like to take more important to few terminologies like adverse drug reactions, adverse event, and side effect. So this is the normally day-to-day life of PV. We often use this terminology, but there are some misconception, misunderstanding at the beginner level. So I would like to clarify with some of the examples. We will jump to the topic. Thank you. So here you have taken a medication, and you have gone through some unwanted, undesirable, or obnoxious or unpredictable effects. So in PV they would be using few terminologies like here I wanted to talk about ADR, adverse drug reaction. In this terminology itself, again they were using some different additional terminologies as a day-to-day practical conversation. They may use, sometimes they will use adverse reactions, they will use, or in that same terminology again they may use like adverse effects. There are some adverse effects that happened like this terminology. So based on my practical experience, they will use the same terminologies as a group. Knowingly or unknowingly, they will be using these kind of terminologies like adverse drug reactions. No adverse reactions had happened, no adverse effects has happened. So always these terminologies would get confused with another terminology which is called adverse events. So these are all the terminology. You have taken a medication at a therapeutic dose for particular for a therapeutic purpose, but you have come across some of the. Let me adjust my screen. Yeah, yeah. You might have come across some of the untowards or obnoxious experiences. So like this terminology is basically some of the things were happened. So at the time, what is the difference between these two and how we can able to understand it easily? So usually these terminologies are usually the getting relationship by the causal association. Usually the causal association. Causal association for what? Between the medicine which you have taken and the effect, the undesirable or unpredictable, whatever obnoxious the event, the effect, whatever it has been had happened to the patient. So I can talk about the event or effect or undesirable thing, whatever it has happened. So if there is a possible, but no one is unsure, it could be may or may not. They are unsure about whether these things have happened between these two. Is they are not sure, may or may not. Might be a temporary association, but it was not concluded, but they don't know whether it has been happened due to the medicine or not. It is not yet confirmed. Wherein in adverse drug reaction, or the interchangeable word whatever they are using, is there is a association has been confirmed. You can say here there is a association between the medicine and the event, whatever happened, it has been confirmed. So that is called adverse drug reaction and adverse event always may not be predictable. Adverse event may not be predictable, may or may not having a causal association. That is one important point what we need to understand. And one more terminology often we use in day-to-day life, that is called side effect. So this terminology also usually we use it. So here we wanted to understand here the side effect. So usually whenever the product, whenever we are manufacturing, after the extensive testing, the product is being finalized into the market. At the time, few of the effects it is already known by them based on the chemical or pharmacological nature of that particular drug, particular medicine. You might be getting few of the effects. Example, like whenever you take an antihistamine, you may get some of the side effect in a sense like drowsiness or dry mouth. So and so things will happen. Here it is known thing whether the physician and the patients both are aware, if I take this may happen to me. So this is a predictable thing, and based on the property of the drug, these things may happen. Sometimes this could be beneficial, sometimes it could be an disturbance to the patient. Example, if you are taking an antihistamine drug, and if you are going for an examination and you may not able to drive, you will feel drowsy, you are unable to concentrate or focus on whatever the activity you are performing. At the same time, if you are taking a medication and if you are don't have any other activity, if you wanted to sleep, you will get a nice sleep and you will relax yourself. So the effect whatever it is coming out of it could be beneficial, as well as sometimes it would be an adverse effect. Example, whenever you are going for some diabetic medication, it will give some weight loss. So it's up to them whether this particular effect whatever they feel they are going to have it is a beneficial effect or do. And also it may cause some drowsiness again and muscle pain. So there so many things may happen. And at the same time, for example, some of the amoxicillin, some penicillin derivatives, it may cause diarrhea. It's a known effect for in a chronic constipation patient. Chronic constipation, if the patient is taking, sometimes they will feel relaxed, they are going to get some of the effect which may give some kind of additional benefit to them. And these are the known side effect. It's not necessary that all the patients who are going to take they are going to get these are all the effects, but some patient may get. That's why I said earlier there were extensive studies made and in clinical trials, and finally they derived, okay, there are some effects may happen, and those effects even the physician is aware, and even the pharmacist aware, and they are going to give them upfront, okay. And these things may happen, but do not need to be panic about these things. This is a temporary one, that is the main important here. These are all the temporary one, and once you stop the medication or the course of the drug is being done, you may get relief out of all this effect. So that's how this is called as side effect. And this is the important note. Now as a summary, when you go and when you come across as a summary, I would like to draw a diagram for an understanding purpose. Like side effect, I would like to put it here. This is a side effect, and above that there could be a thing. I would like to say this as an ADR, like whatever this could be an ADR. And again I would like to draw one more thing, that is like this could be an adverse event. You are not sure about this thing. So as a summary, this would be a take home message here, like this could be a adverse event. Here the causal association, I don't know, whatever I had taken for my beneficial purpose, or a therapeutic dose at at a normal dose for a particular for a reason I have taken, but there is some undesirable effect that happened, but I don't know whether these things had happened. Even no one knows, no one aware, whether the physician is not aware, patient is not aware, or pharmacist or a manufacturer or whoever it may be, they don't know what is happening around here, whether this is due to you know their product or their that event had happened due to, for whatever the reason, they are not even aware of that. So that is called an adverse event. And the second layer here, adverse drug reaction. So here they are getting bit relieved, but there is something happened, ADR. Again, I'm talking about only ADR limited to here, but in a practical thing, sometimes your colleagues or your physician or your client, whenever you are talking, they may use adverse reactions or adverse effects. So they are indirectly they are talking about adverse drug reactions. Here this medicine and the event, there is an established causal association, there is an association has been confirmed, like that their things have set, they have something effect between the medication and this thing. And finally it is an well established thing. Here they can talk about the side effect. So again this will be applying as I said here. So you can think about this particular diagram like a structure, so that it would be very easy to remember what they are talking about. And one more additional point I would like to talk about. Okay, so our pharmacovigilance, our main you know uh, main agenda, main focus is to reducing the possible effects, whatever it happens. So that should be an minimizing the effect for the optimum use of the medication. So for optimal use of the medication is our main focus in our in PV. And also whatever happens, this adverse drug reaction, so this could be divided in many ways, many types, like these are all the types. This is just for your information purpose only, like type A, type B, type C, type D, type E, and type F. Like these adverse drug reactions where is being divided. And type A, usually it is called augmented. Like this is purely dose related effects. It will happen due to a dose related, and they will call as bizarre. So here it is not not dose related. And C is like a chronic, for example a long-term use of the medication. Sometimes it's due to a chronic usage of the particular medication. Obviously it is dose related as well as plus time related. These things would happen. And these usually it is kind of a delayed effect. Sometimes that particular medication have adverse drug reactions or whatever happened due to again delayed effect. Again it is mainly due to time related. And E, again it could be withdrawal, because you have took the medication and you have taken off. Example, usually for some of the steroids or so and so, or some antidepressant or those kind of medication, whenever there is happened at the end of the use, and patient may feel usually some of the undesirable effects. So those things, adverse drug reactions, are called as type E reactions, like withdrawal. And usually treatment failure. Finally it would like failure of medication, failure of therapy. Some of the reactions may happen. Failure of therapy failure. Some of the effects, adverse reactions may happen. So these are all some of the type of reactions your medical physician might be using. This type A reaction, if some of the conversation whenever you are going to have. So these are all the reactions type you can you can come across. And the take home message of this 10 or 15 minutes of session is this one. So you can keep remembering these I like structure, you could able to understand side effect. I know physician know your adverse drug reaction. Yes, something had happened recently, but they have confirmed, like, there is a possible and event, and the reactions, whatever the reactions and the medications have a relationship between this, and adverse event is may or may not. It's a kind of we are waiting slot to confirm this adverse event may come back to adverse reactions, then it may come to also a side effect. So this all about this terminology particularly. Thank you.